As a counseling student, I have not yet committed myself to a single counseling theory. However, I believe person-centered, strength-based, and cognitive behavioral theories are beneficial when working with trauma and grief. For the purpose of this slide um, and this case study, I have chosen to use EMDR as a treatment. EMDR stems from the adaptive information processing model. Under this model, EMDR processing addresses emotional and sensorial distortions and essentially adapts them to the present. This helps a person change their beliefs about themselves and can help desensitize the individual. I recently got trained in EMDR, which makes it possible for me to utilize it. There are 3 stages that I will briefly describe. The first stage is the case formulation. This entails collecting a client's history, typically through a biopsychosocial assessment, which we have already done for this client at the beginning, and creating a general treatment plan that is not only EMDR focused, it is the entire treatment focused. And then also psychoeducation of the EMDR process and completing an informed consent. Stage 2 is where the more intensive prep and processing happens. In this stage, a client learns and implements a plethora of coping skills to help with emotional regulation. This can include mindfulness, breathing exercises, and use of imagery. Once a client is able to successfully utilize these skills in and outside of sessions, they can move into the target planning, where this is basically just a specific plan on what memories and beliefs are going to be addressed in the EMDR sessions. The client will then undergo EMDR via eye movements, tapping, or through the use of sound with toners to help desensitize and replace negative beliefs with positive adaptive ones. And then lastly, in stage 3, EMDR focused on the integration of these skills in the past, present, and future situations. It is important to note that debriefing will happen in each EMDR session of the client, and the clinician will make sure a client has returned to a safe baseline through use of the coping skills learned and implemented in stage 1. Since the client has a history of anger outbursts, critical incident desensitization, or CID, could be helpful for crisis intervention. CID essentially helps process a stressful event or trigger using bilateral stimulation. It takes 5 to 10 minutes and uses a scale to monitor how much the event bothers the individual throughout the process. It is often used with first responders after a difficult call, but has been shown to help other stressors too. Lastly, I think it is important to note that EMDR doesn't have to happen every session. Other interventions can be used too. Such interventions can include CBT techniques, talk therapy, psychoeducation, normalization, grief processing, journaling, and more.